Hi, this is Mark Rabin. Welcome to episode 56 of Lean Blog Audio. It is May 27th, 2015. If you'd like to see this post online, see links or a couple of images that I'm going to reference, go to leanblog.org/audio56 next time you're in front of a screen, and it's safe to do so. If you're driving and listening to the podcast, please wait until you get home or to your office. But today's post is titled Lean, Hit or Myth? Myth. I'm not trying to say miss after a dental appointment. Hit or myth, layoffs, patient-centered care, and more. Now, it's not uncommon to hear different statements thrown around about lean that are more of a myth than anything resembling reality. I remember the time, and I've blogged about this and linked to it, a time when a professor told a group that, well, if Toyota ran a health clinic, a buzzer would go off at the end of the planned appointment time, and the patient would then be kicked out of the room. Well, that's ridiculous. That's a lean myth, and it's not one of the more widely spoken myths, but it's a myth. And a lean myth, and there's some common ones, might be an example of what I've dubbed as an acronym L.A.M.E. Lean as mistakenly explained, L.A.M.E. Now, in the past month or so, I've been giving some talks on Kaizen and continuous improvement as part of a lean workshop series that's sponsored by Kronos, the software company, technology company. And we have upcoming sessions in June in Houston or Seattle if you'd like to attend. They're free. They're sponsored by Kronos. Go to leanblog.org/audio56 to find links to learn more. Now, at these events, I've been happy to not hear any lean myths being thrown around as truth. They have a really solid lineup of speakers from Kronos and other consulting partners that have good things to say. One of the Kronos speakers specifically addressed the idea that there are some lean myths, and she included a slide that said on the left-hand side, myths, on the right side, facts. She said, for one, myth. Lean is about being skinny and cutting to the bone to achieve cost savings. And she says, fact. Lean is about having the right resources in place to do the right work for the patient with the right quality at the right time. Myth. Lean is a harsh management strategy that is strictly data-based, leaving no room for the human side of processes. Well, she says, fact. Lean is respectful toward everyone who participates in a system, including patients, employees, suppliers, the community, etc. And then her third one, myth. Lean initiatives lead to staffing cuts. Fact. Lean is probably the best alternative strategy to the old approach of layoffs and cost cutting. So regular readers of this blog will realize that these are points that I make all the time, and I'm glad that she shares that view and that people are saying good things in these workshops. And this made me think about some other lean myths that I tweeted, and a few others joined in. We're using the hashtag lean myth. So here's a few of them. Lean myth. Manufacturing got lean 20 years ago. Reality. There are still many factories that barely use lean methods and mindsets. So it's a myth, unfortunately, to think that every factory uses lean principles at this point in almost the middle of the year 2015. Or that they have really become a lean culture instead of just using a few lean tools. Lean myth. We implemented lean last year. Well, the reality is, at this point, you don't know what you don't know. It takes time to change your culture. Lean is not something that is a 60-day or a 6-month or a 2-year project. Lean myth. Lean can be delegated to a staff function. Reality. Lean success comes from executives taking ownership, participating, and changing. Related lean myth. We can assign any old project manager to head our lean deployment. Reality. You need an experienced person in that role. Not just experienced as a project manager, but experienced with lean. Because I often run across people who have that project management experience, but knowing nothing about lean, get assigned to lead this deployment or implementation as if it's a piece of software that you install. Now, a Twitter user, Don Sharp, tweeted, lean myth. We have something that's just like lean already. Reality. We have no idea what real lean looks like, and this doesn't really work. I assume he means what they've already been doing. I added another myth. My employees don't have any good ideas. Reality. Well, with that attitude, you're not going to hear their good ideas. Richard Kelly responded on Twitter. He said, Lean myth, that culture change is a series of training workshops for employees, that management understand it already. I'd say the reality is, well, no, it's not just about training frontline staff. It's not the frontline staff that's broken. We need to fix systems and processes and management systems, and that starts with executives. Paul Crickley posted, he said, a lean myth. Lean is just another thing that management uses to control employees. I think that's a good point, and it would be a myth that lean engages people and gets them to participate as opposed to management just telling them what to do or making them work harder. Here's another lean myth. Any poster or sign hung on the wall counts as, quote, a visual. Reality. Visual management are things that make waste and the status of a process obvious. Now, I cringe when I hear people point out, let's say, a warning sign, and they say, yay, it's visual. I'm like, well, no, that sign is at best a bad attempt at error proofing. And it's error proofing that doesn't work. I have a whole blog, companion blog called bemorecareful.com that has more about that. Examples of these warning signs that, yeah, they're visual. You see them with your eyes, but it's not as good as real visual management. Now, my final lean myth. Lean is not patient-centered. Or the reality. Many hospital leaders aren't patient-centered to begin with, and that's often seen in their use of lean tools. Now, you might ask, well, wait a minute. Lean and the Toyota production system is very patient-centered. Who says lean is not patient-centered? Well, for example, the Sun Nurses Union in Saskatchewan has been throwing that around, and they've tweeted it, and there's an infographic that they created that I've shared in the blog post, leanblog.org/audio56. Now, if the nurses of the union are really experiencing something that's not patient-centered, is that really lean? In this infographic, they say that the survey of nurses gives lean a negative rating. More than 60% of nurses surveyed had a negative overall rating of lean, and in 2014 it was 43%. So the percentage with a negative view increased. The number of nurses with a positive overall rating of lean, or at least lean as they're seeing it, or lean as it's being explained to them, or maybe not explained to them, it's dropped from more than 1 in 4 to less than 1 in 10 in 2015. Now, the union in their infographic asks why such a low rating, and they say two things. Lean is not patient-centered. Lean is not appropriate for healthcare. And so they say 1 in 3 said that it's being implemented in ways that's not patient-centered. So if that's true, that's a problem. It might be a problem that with what's happening there, but it's not a problem with lean philosophy or lean as practiced in many organizations. So, the infographic begs other questions. How were the survey questions asked? Were they biased questions? Was it a scientific sample of nurses? But more importantly, in my experience and the experience of many others, lean is patient-centered. That's what lean is all about in any industry. Customer first, safety first, improving the customer or patient experience. Now, in the past, Dr. Don Berwick, one of the preeminent healthcare quality leaders, has said something like, lean and patient-centeredness are the very same thing. Virginia Mason Medical Center proves that lean is appropriate for healthcare and is patient-centered. And I've linked to an article in their book. So from an article, it says, quote, nurses who once spent most of their time fetching things they needed, walking as much as 5 miles a day to track down supplies, now have materials delivered to them and spend 90% of their time with their patients. Previously, when a patient was hospitalized, staffers might trickle in one after another, nurse followed by doctor followed by nurse. Today, the whole care team of doctors and nurses and other support personnel enters the room together and greets the patient, with the doctor laying out a clear course of action. Colleagues constantly share data. End of quote. So all of that to me sounds very appropriate, very patient-centered. People working together. Patients not being confused about who is who. Nurses having more time at the bedside. Lean as implemented at Virginia Mason Medical Center, I think most of the staff there would say it is patient-centered and it is appropriate for healthcare. Now, in the post, I've shared a video from Park Nicollet about their wonderfully patient-centered, lean-designed cancer treatment center. I would encourage you, go to the post, look at this video, or search YouTube later for Park Nicollet Cancer Center. And in the video, they talk about how everything comes to the patient, how it was redesigned for patients to be in that same room for everything but radiation treatment. That's appropriate to healthcare. That's patient-centered. Now, lean principles, again, going back to Toyota, say to focus on the customer and their needs. Unfortunately, that doesn't mean that every hospital or factory that uses lean tools or is, quote, implementing lean adopts those important mindsets. Reading about my friends at a Dutch hospital and their loving care philosophy, as they refer to it, I've linked to that on my site. They've labeled lean as loving care. How do they create more time for nurses to have more interaction and caring moments with patients? That's appropriate for healthcare. That's patient-centered. So I don't know how people can paint with a broad brush that lean is not patient-centered. Now, they have their experiences, which might be bad experiences, but there are so many other organizations with good experiences. I would hate for anyone to think that lean is not patient-centered, that lean is not appropriate for healthcare, when we have so many cases we can point to where lean, as adopted and practiced in accordance with these principles, is both appropriate and patient-centered. So back to the general question of lean myths. What other lean myths do you hear? Share on Twitter using the hashtag #LeanMyth, or come to the blog post to leave a comment. leanblog.org/audio56.
Podcasts are sponsored by KaiNexus, where we're passionate about helping the world improve and innovate more effectively with our web-based software. Learn more at www.makeimprovementhappen.com.